A little bit about sexual assault by Dr. Michelle Stevens. Sexual assault is a broad term that describes any sexual act that is coerced or in which the victim is incapable of providing consent. Rape, drug-facilitated assault, intimate partner violence, groping, and sexual torture are all forms of sexual assault, as are flashing, peeping, catcalls, and sexual harassment. Unfortunately, sexual assault is incredibly common, with someone in the United States being assaulted every 98 seconds. About 1 in 6 women and 1 in 10 men have been victims of rape. The majority of sexual assaults are committed on people under the age of 30. There's a general belief that most sexual assaults are committed by strangers, but that's not true. More than 70% of all sexual assaults are perpetrated by someone the victim already knows. Sexual predators tend to be repeat offenders. In fact, more than half of the people arrested for rape have already been convicted of at least one prior rape. Sexual assault causes a staggering array of negative effects. Immediately after an attack, victims may have to cope with physical injuries, STDs, or pregnancy, as well as flashbacks, lingering feelings of fear, and insomnia. If these feelings persist, they can eventually lead to the development of post-traumatic stress disorder. Victims of sexual assault are also at increased risk for developing depression, suicidal feelings, substance addiction, and eating disorders. Victims often have problems with trust after an assault and may have problems forming healthy relationships. They are also at increased risk for self-harming behaviors. How a victim of sexual assault is treated right after an attack or right after telling of an attack has a direct impact on how quickly and how well she will heal. If victims are treated with callousness by medical personnel, law enforcement, friends, or family, if they're blamed for the attack or not believed, they are much more likely to develop long-term symptoms of trauma. In order to ensure the best long-term outcome for a victim, she or he must be treated with kindness and compassion directly after an assault, or any time the victim chooses to disclose information about an assault. It's important to believe a victim of sexual assault. It's equally important not to imply to the victim that the attack was somehow her or his fault. Directly after a sexual assault, helpers should ensure the victim's physical safety and facilitate medical care if necessary. It's important to give the victim control over the situation by allowing him or her to decide where to go and who to be with. Right after an assault, victims may or may not want to talk about what they've been through. It's important not to press the matter. The first rules are to help the victim feel safe again and back in control. If treated well by the people around them, victims of sexual assault will naturally start to feel better over time. Others may need some form of group or individual psychotherapy to process the trauma they've endured. Medication can also help in alleviating feelings of depression or anxiety. With proper care and treatment, victims of sexual assault can overcome what they've been through and go on to lead satisfying, successful lives.